Doctors and nurses are on the front lines of this war. They are risking their health and their safety, often with little protective equipment. Here's what they say they're facing in their own words.
Hi, everyone. My name is Dr. Kalila Gates. I am one of the pulmonary critical care specialists at Northwestern Medicine in Chicago.
I am a per diem emergentologist / emergency physician.
I work on the COVID unit that we created 2 weeks ago.
The unit that I work in is a COVID quarantined critical care unit, highest acuity, sickest patients that we have in the health system right now.
Our COVID unit was about 2/3 full today. Our ICU is about half full today. We've seen a steadily increase in our COVID-19 admissions over the last 2 or 3 days.
I'm in one of the field tents that's being set up right now. It's at a hospital that's being overwhelmed, one of many, and essentially they are popping up all around the city. And when I'm not seeing patients on my day off, I'm helping in with setting up for mass casualty scenarios and telemedicine, so doctors who are remote inside the hospital can quickly assess their patients inside these tents.
I think the hardest thing when it comes to patients and patients being scared is it's the moments that break your heart right now. The fact that we know that patients, they can't have a visitor at their bedside. And when you come across that patient in the car line who is so ill and they have to come inside and they need rapid intervention right now, they have this moment where they look at that family member that drove them there and they're both wondering, am I going to see this person again?
I have anxiety from the unknown. What do we expect in 2 weeks? How many patients will we see? Will we have enough PPE? And we're told that we will. There are reports from other places that is not the case for them. And so that is a source of anxiety.
The other night I was helping take care of a ventilator patient and I stood on the other side of glass doors and I just took some time and watched him and thought, what was his story? What's his family like? Where does he work? What does he like to do? And I wish I could have been able to ask him those questions. Unfortunately, yesterday afternoon, he passed away at the age of 45.
When a nurse tells you that it's bad, it really is. And some of these COVID-19 patients that come in, they're fine for a little bit, but then their oxygen demands steadily increase. And we've been transferring to the ICU at least 1 to 2 patients daily.
Even on my day off, even as a per diem, I feel like I have to go in because this is war and it's not going to get any better if we call out.
My colleagues have been here. They remain here. And the message that we are sending to each other is that we are here for each other. We are here for our patients. And we are here together to get through this crisis.
Never seen times like this in nursing and in the world. And it's scary every day. But every day we just try to love bigger and care bigger and keep pushing forward. Because that's what we do, and that's what nursing is. And we run towards people while the rest of the world hopefully can stay away. That's what we're here for.
Should you wear a mask to protect yourself from the coronavirus? Here's what the U.S. Surgeon General said this morning.
It's important to know the CDC, the World Health Organization, and my office originally recommended against the general public wearing face masks based on the best available evidence at the time regarding whether or not they could prevent people from catching the coronavirus. We now know that there's a significant amount of asymptomatic spread, and the task force has asked the CDC to look into whether or not we should change our recommendations. If you're going to wear a face covering, please save the N95 mask for healthcare workers.
Infectious disease expert Dr. Catherine O'Neill joins me now from Louisiana. Dr. O'Neill, thank you for being here. I would love to get your take on this. Do you think that the general public should be wearing things like masks and gloves when they go out in public? A lot of people just aren't sure what to do.
Thanks for having me, Allison. Let's tackle that question in two parts. Gloves are an absolute no. Okay. In medical care, we have never used gloves outside of direct patient care and discarding after use. They get dirty, it's impossible to clean them, and people feel protected when they're actually not. So glove use can definitely spread disease, and I would not recommend it. We have great ways to prevent our dirty hands, and that's washing hands. So we want to continue to spread that message. Masks are a different topic and have been an incredibly difficult topic over the last week as we see the fear of asymptomatic spread race across our nation and in our community just as much elevated in the conversation. We have never used masks in the community as a tool in our toolkit. We have used social distancing, we have used hand hygiene, we have used wiping down shared surfaces, but we don't seem to be making enough ground to flatten the curve. And so this additional tool of masks has come up. I wish I could tell you that we have enough masks for everybody to use outside of the hospital and to still protect our healthcare workers in the hospital, but we don't. And so if someone feels like they need to wear a mask in the community, it will have to be a handmade mask. The protection of handmade masks is something that hasn't been well studied. It's definitely not encouraged in the hospital, but it does protect your cough. And so for Americans who are out there and want to go take a walk, if they wear a mask, it does protect others around them from their cough.
You mentioned those handmade or homemade face masks. Senators Toomey and Bennett are calling for people to wear those. And the president has even suggested people could use scarves. Are those effective solutions? And is one better than the other?
If I'm sick and I have droplets that are infectious and I'm standing next to my colleague and I don't want to make them sick, I can cover my cough with my arm, which is what we've always recommended people to do, or you can cover your cough with something else. A scarf, a mask is going to catch the droplet. So yes, they're effective in catching a person's droplet if they're sick. If you're sick, you should be home. If you're sick, you shouldn't be in the community. You shouldn't be standing next to your colleagues. That continues to be the best defense we have is social distancing.
You are based in Louisiana. We know that New Orleans is a hot spot there. The governor warned earlier this week that the state could run out of ventilators. What is the situation like where you are?
In Louisiana, we've seen in the last week in our community, which is Baton Rouge, we have a lot of people who commute back and forth between New Orleans and here, and in the state itself, an increase in cases, despite the fact that we're greater than 2 weeks from the governor's mandate for everybody to shelter in place. So as we continue to see those cases increase, we are concerned about scarcity of resources. In our community right now, we are lucky that we have ventilators today. We are concerned what the next 2 weeks are going to bring. We're starting to see that we're really holding on to our PPE. We're about a week ahead in PPE use. We have ventilators for our patients today, but the rate of increase is alarming. And in the last week, we've begun to prepare for what is the next step when we run out.
I'd like to play a clip of a New York City emergency room physician describing the conditions that he's seeing. Let's play that.
I'm seeing EMS stretchers lining up down the block, waiting up to 5 hours just to be triaged. So imagine calling 911 and expecting to see a doctor immediately when you get to the hospital, but then being told that you have to wait in line for you don't know how long, and it ends up being 5 hours.
What those doctors are seeing and are dealing with is just overwhelming, to say the very least. Besides personal protective equipment, what are some of the other major challenges that these doctors and nurses are dealing with?
Today, we're worried about viral testing media, who's positive and who's negative. That's been a shortage that we've experienced over the last couple of weeks, and we know that we won't have much left. We're worried about the rest of the respiratory equipment. We keep talking about ventilators, but today we brought up the concern that we don't even have enough ABG kits. So how many ABG kits do we have in the state? Can we allocate those resources to the ER to be able to tell how much oxygen somebody's actually getting? The hoses and the connectors for all of our oxygen equipment, all in short supply. So as we look at just giving oxygen to somebody, it's more than just a ventilator. It's all of the equipment that comes with that. And what you hear in that New York story is bed space, just physical space to put patients. As we increase our capacity in the hospital and add ICU beds, we run out of space. And so with every part of this disease, we are finding that there's a scarcity of resource in each step of the way.
President Trump has extended the national social distancing guidelines through the end of April. We know the governor of Louisiana has extended your state's stay-at-home order through this month, too. How can we tell if social distance is working?
We're going to have to see a flattening of the curve. And so what we haven't seen in Louisiana yet is enough of that flattening to be able to get through the end of April and know that we have enough beds in the state to house every patient who shows up. So we want to get to that point so that we don't end up having the same story in 2 weeks that we just heard in New York. But right now, our trajectory looks like in 2 weeks, we will be there if we don't start to flatten the curve. The only way, as we talked about with masks are not the best protector. You have to keep away from people, and that is where social distancing comes into play. Everybody's got to do their part. It's really difficult. People are finding ways to get out. Dr. Fauci talked today about going for a run in the evening. You have to get out when it's safe to get out, and you can't speak to other people. You have to congregate in a very small group of your family and find the ways that you can live normal life, but without communicating with other people and keeping your distance.
I'd love to ask you a few viewer questions, if you don't mind. And one of them is on that topic. You touched on it, but I want to make sure we really hammer it home because I know how important this is. A viewer asks, if you have been home quarantined for 2 weeks and you don't show any signs of coronavirus, is it okay to go and see people who have also been staying inside and don't show any symptoms?
If you have been home quarantined for 2 weeks, I'm assuming that you've had the virus and that you're recovering. We have seen cases in China, especially that have shown that people can shed for a little bit over 14 days. We know that most people have shed within that 14-day mark, but I wouldn't consider visiting with anyone who you're going to come into close contact with safe at this point. We're in a shelter-in-place order for a reason, and besides the need to work and come to work, I would continue to call your friends on the phone. I would continue to FaceTime, but I would not do any personal visiting right now.
This is a question that we continue to get. I think people are really worried about this. If you do get the coronavirus, can you get it again, or are you immune to it?
Like most viruses, we know that some immunity builds up. We are already starting to see some people who have IgM and IgG antibodies, which means they will have some protection. In our CDC guidelines on what to do when our resources do become scarce, we talk about those who are protected. What we don't know right now is how long that's going to last. Is that 6-month protection? Is that 3 years protection? Is it like the measles where we get more than 5 years protection? That remains like many things to be answered as we learn more about the virus.
Dr. O'Neill, thank you so much. We know you are so busy right now. We're grateful for your expertise and all the advice for our viewers. It's really helpful in a time like this. Thank you so much.
Thank you, Allison. We appreciate it.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.